Hi, good evening, viewers, and welcome to your favorite show, Ask Dr. Saw. We're really enjoying these moments that we're spending with you. And we don't have Dr. Saw here as yet in studio, but Dr. Saw is back in England. He was in New York last week, and he's in England now. So, Dr. Saw, welcome to the show.
Oh, thank you. Thank you for having me again.
Yeah, I hope that we can have you in studio very soon.
Absolutely. Try my best.
Yeah, it feels
I'll
better.
get there.
It feels better having the doctor close by. Doc, last week we dealt with we spoke about blood in the stool, and of course there were a number of questions that came up that we are going to be dealing with in the second half of the show. So just to let you know, viewers, that after this first half an hour, we'll be discussing a specific topic. After that, you'll be dealing with your questions. So your questions will be dealt with at the end, in the next half an hour. And today, Doc, we're going to be talking about blood in the urine as a follow-up to blood in the stool from last week. So lead us off with that topic, please.
Absolutely. So lots of times we can go on the internet and read about things. And of course, you can read about a condition and you have a better understanding of it, but still you need a medical professional to put it in context. But ever so often we have symptoms or signs and you don't know what to make out of it. You're thinking, always you tend to think the worst. And of course, I always tell patients, my job as a doctor is to rule out the worst case scenario. Mm-hmm. And once we have excluded that, then we know the rest of it is not so bad and is manageable. However, it is alarming when we see blood anywhere, in the stool, in the urine. So on other sessions, we will go on to talk about, other blood in other parts of the body. But let us look at specifically today, we're going to look at blood in the urine. And by definition, it says for itself, it is you noticing blood in your urine. Now, there's a medical term for it. It is called hematuria. Have you heard of that?
Hematuria, yes.
Yes. Okay. So that is what we call blood in the urine. Now, you can have what we call frank blood. That is, you see it, or it's called macroscopic hematuria, where you see the blood. So you pee in blood or something like that, or you see blood in the toilet when you pass urine. And there is something called microscopic blood or microscopic hematuria, where you don't see it. The urine looks normal, or it may have a change of color. But when you look at the urine sample under a microscope, you see blood in it, right? So you see blood cells. Because blood cells are very small, and you tend to see that. That is called microscopic. So I'll touch on both of them. But coming to the cause. So, okay, fine, you see that. You can actually, so the important thing is to establish. In a man, it is easy to say, I have peed blood, right? Because you could see the blood passing through, when you pass urine. In a woman, however, sometimes you're not quite sure, because the opening of the urinary tract is close to the vagina itself. So it's at the top of the vagina, and there can be a confusion as to, is this blood actually coming from the vagina? Right. And the vagina is a different system by itself, so that leads into the uterus, that's the womb. So it is very important. And of course, women get periods and they can always have in-between bleeding. So sometimes they're not quite sure where the blood is coming from. But if they identify that opening where the urine comes out and they can see for sure that there's blood at that opening, then you could say clearly this is blood in the urine. And most of the times, they would also have other symptoms of urinary problem. So when you are taking a history of blood in the urine, you want to establish a couple of things. You want to establish, so when we're looking at what are the likely causes, we want to know what other symptoms are you having to link it. So if someone comes in and say, I've got blood in the urine, then of course I'll ask, do you have pains when you pass urine? And that is called dysuria. Or burning sensation when you pass urine. Are you going more often to pass urine? Do you have pains in the tummy? So these are things will tell us as to the possibility and say, fine, if a patient has got blood in the urine, they have got urinary symptoms, then I would say, fair enough, this is from the urinary tract.
Right.
So, okay, let us say now we know you're passing blood in the urine. We want to know what are the possibilities, where it is coming from. So the urinary tract is a closed system, more or less. So let us look, I mean, I don't have a diagram of that, but we can visualize. You have the two kidneys on top.
Yes.
And the kidneys, blood flow into the kidney, right? And you have the two kidneys. Then it is attached downwards by the ureter. The ureter is a tube attached to the kidney that goes to the bladder. So the bladder is like a reservoir. So you have that. And then from the bladder, there is another opening called the urethra that leads outwards where you, the opening to pass urine. So in the woman, that goes to the top of the vagina, right up at the top of the perineum. And then in the male, that passes through the penis, and you pass urine, right? So that you've got kidney, ureter, the bladder, and urethra. So the ureter and urethra sounds alike, but they're spelled, they're pronounced differently and spelled differently. So let us not confuse.
Yeah.
So what can happen? You can have bleeding from anywhere in the urinary tract. So if you notice blood in your urine, we're talking that the bleeding can come from starting from the top kidney. It can come from bruising of the ureter. It can come from the bladder, and it can come from the urethra.
Right.
Now, in male, there's an additional organ called the prostate. So after the bladder, there is a walnut type of structure that's called the prostate. You know, we spoke
Right.
about
We
the
spoke.
prostate.
Yeah.
That's right. So the bleeding can come from anywhere there. Now, what we need, therefore, is take a history. So let us start with conditions of the kidney. So if we're looking at conditions of the kidney, lots of times, kidney, if you have kidney stones, that's one. You get a stone in the kidney. As the kidney stone passes, it bruises the tract and it causes bleeding. However, those patients would come and say, Doc, I've got pains. And we'll talk about kidney stone. I think we spoke about that in the past.
When you just tell me about that, it sounds so easy. But I'm going to share my experience with you because it is my first-hand practical experience of having bleeding in the urine. So I'm going to share that with you in a minute.
Correct. Yeah.
And for our viewers also, because I'm sure some people may want to know what are some of the symptoms that you get with these things. I can tell you, but yes, maybe there are people who would have gone through this also. And I know we have a very engaging viewership also.
Absolutely. So looking at the kidney, so we look at kidney stones, but kidney stones usually associated with pains. And of course, the pain can start from high up in the back because the kidney is like more at the back part, upper back.
Yeah.
And then it radiates as the stone passes. It can go down to the ureter, to the bladder, and sometimes you get pain radiating down the groin into the testicle along that area. So that is the kind of reformed pain as a result of the kidney stone, and you may pass blood. So the history tells, a little bit of your symptoms will say, fine, this is suggestive of kidney stone. Another condition of the kidney, so we'll talk about kidney and then move to the different parts. Another condition of the kidney, you can have kidney cancer. So that is not very common. It's a rare condition, but you have it. You have it both in children and adults. So always at the back of our mind, if there's passage of blood, we are worried that fine, it could be cancer, and it could be from any organ in the urinary tract. So here we're touching specifically on the kidney. But listen, more important, also, as I said, other symptoms tend to give it away. Lots of time with cancer of the kidney, you don't have pains. So if I have kidney stone, I will have pain with blood. If I have cancer, I may not have pain. You may just have the passage of blood, and then we have to investigate the kidneys, right? Another condition is something called glomerulonephritis. So glomerulonephritis, as I said to you, that the blood flows into the kidney, and there's a little capsule with a collection of blood vessels and tubing So the blood filters, it end up into a tube. So these are collecting tubes, sort of, and it filters through the kidney. And that is called the glomerulus. So in glomerulonephritis is inflammation of that apparatus, that structure where the blood filters into the collecting tubes, which we define as the glomerulus. There is inflammation there, and you can have bleeding in that in those areas, and you have blood in the urine. Now, this is a very important condition, and lots of people, we see this in children, we see it in adults as well, and it's a common cause for kidney failure. So glomerulonephritis is not something we take lightly, but there are other telltale signs, that would tell us. So if somebody come in with damage to the glomerulus, I would expect that they have some changes where the filtration of urine is not happening properly. So sometimes you have protein in the urine. So when you test the urine, you don't only see blood, you see protein. And also, the kidney controls your blood pressure. So you may have symptoms of blood pressure problem in those patients. Your blood pressure may go excessively high. And we have seen children presenting with blood in the urine and blindness. And the blindness is because their blood pressure sky so high, they have what we call a hypertensive emergency. And I have seen that in children. So the parents will come and say, Doc, patient passing dark urine, blood in the urine, and they may probably get a rash, they may complain of a sore throat prior to all of this, and then they go blind, or they can't see, or they get severe headache. So the headache and the blindness is as a result of excessively high blood pressure, but that is because the kidney is damaged from the condition called glomerulonephritis. So that is an extreme example I've given you, but it is not something trivial. It's something that we take seriously, and in the form of it. So anytime there is blood in the urine, everyone should have their blood pressure checked. If they're not known to have blood pressure and the blood pressure is high with blood, you need to go and exclude kidney problem, because if it is not treated timely and adequately, it can lead to kidney failure, where then you end up having dialysis. Or transplant.
Yeah.
Right. So moving on from the kidney now. So those are the common conditions of the kidney. So we look at stones, we look at glomerulonephritis, we look at cancer. Those are your common things. We'll come to infection, but generally infection would happen anywhere from the kidney downwards to the bladder, and that can give you blood. So coming out from the kidney, you have what we call the ureters. I said the tubing that leads to the bladder. Again, conditions of that can cause it. So bruising, irritation, inflammation, and bruising generally is caused by stones moving from the kidney downwards. So as the stone moves, you have that colicky, on and off pain, and then you have bruises and you have bleeding.
Let me share, Doc. Let me share my experience with you as we were talking about it. In 2020, that's when I discovered I had kidney stones. You know, I started getting this very sharp pain in my lower back, and I wondered what it was, because it didn't seem muscular or skeletal in any way. But so when I decided to check with the hospital and they did an ultrasound, then they realized that I had a stone. I think it was 8 mm or something like that. It was, and there's some other small ones. Now, these stones started to pass because I started drinking more water. What I found though is that I think I developed these stones, and I could be wrong. You're the doctor. But I was not one to be drinking a lot of water. I used to, sometimes you just take a little sip of water, but then if the whole day don't drink anything, late in the afternoon you drink some Coke or something like that. So there's no liquid. And the flushing system for the kidney probably was not there either, right? So things are building up. But I'll tell you this, Doc. When that stone was passing, coming out, I can feel as if shards of glass is passing through. And you can feel the cuts, but it is not just the cuts alone. You actually see in the bleeding, the blood, that what you call frank blood, heavy blood sometimes, and it's very, 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 very painful. So it took me maybe a couple of months until I actually passed. God is good. I passed the stone. It was stuck in that bladder, and it was stuck in the distal region for a while. And then eventually the body finds a way to eliminate these things, I believe. But that urine in the blood that came from a kidney stone, I can say with all assurance, yes, you said it comes with pain. It is not going to present itself anywhere else. Severe pain
Sure.
too.
Well, I mean, it is. I mean, lots of people have got kidney stones, and thank God, most of them would pass it. The ones that are big, and the danger generally. So you can get kidney stone. You'll have lots of pains, as you say, and rightly so. You've identified one of the reasons. You didn't drink water.
Yeah.
So water dilutes the kidney. Remember, dilutes the urine, and if you have concentrated urine, you have more likelihood of formation of stones. You have crystallization and stone formation. Now, so water is very, very important. Now, there are also certain other genetic factors for stone formation, and of course, dietary factors, things like calcium. So the stone is generally made up of different components. So you can have calcium stone, you can have oxalate stone. So these are different salts. You can have uric acid stone. You know, patients who have got gout, they have high level of uric acid, they can cause stone. But importantly, if you drink enough water, you can dilute that, concentrated urine, increase the risk. And there's a theory where infection also can promote formation of stone. So patients with recurrent infection, they can also promote formation of stone. But you rightly said, the stone gives you excruciating pain, and you feel patient will indeed, because as it passes, it damages the lining as it's coming out, and you feel cuts and bruises. Now, the danger is if that stone gets stuck along the passage. So normally, sorry, I got a bit of a cough.
That's all right. Yeah.
I need to
you need to see Dr. SAWH.
Yeah. So you have the urine pass, the blood filters in the kidney, and it forms a filtrate, and that's the urine, and it leads down into the ureter, into the bladder. Now, if you block the flow of that, right? So let's say you got both sides of your urethra lead into the bladder,
Yeah.
and a stone gets stuck there. Think what happens.
I had the problem. I had that exact problem. So I wanted to pee so bad, and all I'm doing is barely dripping, and the
Right,
dripping.
so you get an obstruction.
Right, and the dripping, and I can feel my tummy, is full and all that. And the dripping, as much as it is dripping, barely dripping, it's also dripping blood, because it's also pushing this thing against these shards coming through.
Correct.
So yeah, I had that. There was no urine flow.
So if you have a blockage, what tends to happen? You have a backflow. When there is a backflow, you get swelling of the kidney, and that damages the kidney.
Wow.
If that is not treated adequately, imagine your whole kidney could be knocked out and totally damaged if you don't relieve that obstruction. But you'll know, because once you get this a condition called hydronephrosis, because you blocking the flow, you get backflow, and you have swelling, and that damage, the pressure becomes high in the kidney, and it damages the filtration system. And I've seen patients who ended up with, we have to remove the kidney because it's so badly damaged.
Wow.
So it is important. Thankfully, it's very unlikely for you to have a blockage on both sides. So in those patients, if you get blockage on one side, we managed to salvage that kidney, but thank God we have two kidneys, and the other one will probably function as per normal.
Yeah.
But because of time, I'm trying to, let us proceed. How are we doing with time?
Yeah, we're doing good with time. We have about 12 minutes more. But okay, let me share another story with you. And as I said, I love to share the story because it's things that I went through, and I wonder if people go. I was about 9 or 10 years old. We were in an island called Wakenham. So one of my uncles came to visit, and he was going back with the Malali back then. It's no transportation on the island, so you got to go all the way a couple of miles from where I was living, a place called Melville, to the Stelling in Good Success. Now he forgot an envelope, and my grandmother told me, take this on. That he forgot his envelope. I got to take it. So man, I took off with a speed, and I ran all the way and made it before the boat left to give it to him. When I got home later in the afternoon, when I went to pee, it was a lot of blood in the urine. Now, at that point in time, well, I told my grandma about it. Nothing happened after that. But is it that because I exerted so much effort
so
that
that's called exercise-induced hematuria.
Okay.
So we get that as an established condition. After exercise, jogging, running, you can have hematuria. Usually they are innocent, they're transient, and they disappear without treatment. So that's called exercise-induced hematuria. So that's another cause.
Let's a patient who well, not a patient, someone who sees this and they know they know that they did some strenuous exercise and so on earlier. They shouldn't be too worried. Wait until see if it's going to continue.
Well, yes. I mean, the point is, remember, our job, as I said initially, is to rule out the worst case scenario. I will never say to somebody, you've got blood in the urine and wait.
Okay.
So I would say, yes, you can think in your head, because most of the time we're thinking the worst.
Right.
I would say, fine, I've just exercised, I've seen blood in urine, I don't have any other symptom. This is more than likely exercise-induced. I wouldn't panic, but I would still see a doctor, because what about if my blood pressure is high? What about, is that a coincidence? You understand? And lots of times people attribute things, and they will come and tell you stories that, I've done this, and this, I noticed this, so they link the two. But that is just a coincidence. And you never take it for granted that this is that's the best case scenario, because it is something important. I've just said to you, kidney is something serious and is an important organ. So I don't want us to miss something. So I would never advise someone, right, you've seen that, you can think that is the best case scenario, but let me get it checked. Let me ensure that there was nothing else going on. So yeah, I would still say go and have your blood pressure checked, see a doctor, at least say fine, I don't find anything else, I'm just going to run a little test here, ensure that you're okay. A couple days after it's gone, then I say fine, there's nothing else, all your organs look well, I'm not bothered. So okay, so we talk about kidney, we talk about coming down to the ureter. Let's talk about bladder. So as you come lower down now, that's where your bladder is. So where is your bladder? Your bladder is below your navel and before your pubic area, just around your pubic. So it's by your pubic area and your belly button, below your belly button.
In the pelvic area there?
Right, that's the pelvic area, right? Yeah. So that is where your bladder is. And the bladder is quite superficial because it is right down under there where, after you remove the skin and the fatty tissue, you find the bladder is very superficial. So as the bladder descends, you can see your belly swelling out sort of in the lower tummy. And when you have you can't pass urine, and this happens in men with prostate as well, sometimes it becomes so unbearable that, it becomes so unbearable that the bladder gets swollen, and then you have to put a catheter to relieve the pressure. If the catheter can't go in, we sometimes we just stick a needle and drain it. So it is so superficial. That is.
So you go straight through. You go straight through from the tummy into the bladder and drain.
Into the tummy, you stick a needle into the bladder.
Yeah.
That is if you're trying through the penis. If you put in a tube to the penis or in the woman to the ureter, and you can't get into the bladder for whatever reason, you can stick a needle straight into the bladder and drain it. So I've done that many times in patients with prostate that is so blocked get into the bladder. So bladder conditions, and bladder conditions are, you can have cancer of the bladder. You can have, and that's the most important one that I would want to rule out. If you have blood in the urine, always we want to ensure that you also don't have cancer of the bladder. So you should have a urine test. We normally look for some cancer cells, so you can do something called a cytology, and also we'll scan the bladder to see if there's anything in the bladder. In patients where we don't find a cause and you still have blood in the urine, we will put a camera to have a look in the bladder. So that is called a cystoscopy. Because sometimes you have cancer of the bladder and you don't see it on a scan because it's not big enough. It's just the area of the bladder is inflamed. So you put a camera in and you see that area is all red and inflamed. You take a sample there, put it under the microscope, and there are cancer cells. So blood in the urine, you always want to make sure it is not cancer of the bladder. But by and large, I don't want patients to panic every time they see blood in the urine, they worry. The most common cause for blood in the urine in women is urinary tract infection, which is so common. I will do a topic on UTI, that is urinary tract infection, as a separate topic, because there are so many urinary tract infection. You have different types. You have acute, you have chronic, you have recurrent urinary tract infection. There are patients who get urinary tract infection after menopause. There are patients who get urinary tract infection after intercourse. So I think we will dedicate a topic to that. But coming back to that, because we're beaten for time. I think we got about 7 minutes or so.
6 minutes,
Yeah. So I'm trying to, be quick on this one here. So the bladder cancer is important, and inflammation of the bladder, infection of the bladder, we call it cystitis. There's a set of condition, I don't know, it's autoimmune, lupus. You heard of lupus?
Yes.
You can have cystitis or inflammation of the bladder, not necessarily infection related, but inflammation. And that can also cause blood in your urine, right? So just bear in mind that, there are other causes. And of course, patients with urethritis or STIs, sexually transmitted infection, where the lining of the passage of the urethra is inflamed, you can also have blood in the urine. And importantly in men, let us don't miss this, prostate problem. Common cause for blood in the urine is prostate cancer, and even innocent bleeding from the prostate. As the prostate enlarges, you can have blood vessel that can burst and give rise to hematuria. So you could have blood. So we've covered the bladder conditions, we've covered urinary tract infection, which is by and large the most common one, and then of course prostate issues in men. And so those are in summary, the causes of blood in the urine.
Let me ask this though. You mentioned UTI and STI. And before you even mentioned STI, this came to my mind to ask this question. Sex or intercourse during having these conditions, what is advised? Because let's say somebody is seeing traces of blood, you're not sure where it's coming from. Like from a woman, well, it's a man. From a man, when you pass in blood. What are the guidelines?
Okay, so if a man has got blood in the urine and he doesn't know the cause, I would not suggest that he go and have sex without establishing the cause. As you rightly say, it could be an infection, and you can transmit that to your partner, right? So blood in the urine by itself, it's not that it's something that's stopping you from having sex, but as a precaution, you should not, because you can transmit that. If you say, fine, I really want to have sex, and you want to use a condom, it's difficult, because if it is due to stones, you'll be in pain. I don't think you'll enjoy sex at that point.
Yeah.
So it's not recommended, but it's not that it is impossible, right? But let us go to a woman.
Right.
If a woman is bleeding and it's from the urinary tract, the most common cause in women is urinary tract infection. And of course, they can have infection of the urethra, sexually transmitted infection as well. So again, I would not encourage sexual intercourse. But if they know the blood is coming from the vagina, and this is, let's say, period related, because there's so many women who have got period in between bleeding.
Irregular, that kind of thing, yeah.
Still go ahead and have sex.
Yeah.
So that is not a contraindication that you can't have sex.
Okay.
But you just got to be cautious, and you got to know, are you in pain? If you're having an infection, pelvic inflammatory disease, that is infection of your pelvis, you don't want to have sex then. You can spread the infection. So if it is fine, this is a hormonal type of bleed. And, my partner is going to use a condom to have sex. And this is something I get a bit of bleeding after sex. Because sometimes women who have got cervical polyps, who have got fibroids, who have got adenomyosis, different endometriosis, they can have a little bit of bleeding during intercourse. And they know that, that happens sometimes. Or if they're hormonal imbalance, all these things can give rise to a bit of bleeding. And you wouldn't say, fine, because I'm bleeding, I can't have sex altogether. It has to do with how you are, but there would be not necessarily a total contraindication. You got to know what are the causes, what are the possibilities. Is this infective, inflammatory? If it's inflammatory or infective, you don't want to traumatize it, because sex also is traumatic. And we didn't talk about trauma. Trauma by itself can cause bleeding.
Right.
You can have sex, there are patients who engage in traumatic sex, very aggressive sex, and they will come to me and say, after intercourse, I've got blood. We investigate them, there was nothing to find, and that we would probably presume is traumatic hematuria as a result of sexual intercourse.
But on that point, before we close off, what about external trauma? Yes,
of course. You have external trauma. So any trauma hitting of the penis can cause bruises, you can cause that. You have bleeding on the glands, the head of the penis, the foreskin can bleed.
If something or someone or a cricket ball hits you hard in the region of the kidney, could that impact also cause bleeding on the inside of the kidney?
Yes, definitely. We always ask anybody with trauma to the kidney, injury to the kidney, we always ask if there's blood in your urine.
Right.
Because remember, you have bruises. Bruises mean there's bleeding.
Mm-hmm.
You have bleeding in the blood vessel. It just seeps into the kidney, into the urine, and you can see blood. So yes, trauma is a very important cause, and anyone with trauma, we always ask. If there is trauma and there is bleeding, you should always see a doctor. We will scan your kidney. And quickly on the investigations, what we would normally do, and just let me just touch on this quickly. There are also times when you're on blood thinning drugs. So if you have had a heart attack, stroke, and you're on blood thinners, or you have irregular heart rhythm, something called atrial fibrillation, or previous blood clot, they put you on blood thinners, and that can give rise to bleeding, spontaneous bleeding, and you can see blood in the urine or blood in your stool. So that's an important cause to bear in mind. People with clotting disorder, where their platelets are low or the blood is thin. So there are sometimes you have bleeding disorder as a result of an abnormality of your blood itself, and that can cause. So when we are investigating patients, we want to do their full blood count. So that is to check that if they're anemic. So if you bled a lot, your blood count will drop. You'll be anemic. We want to check if there's any low platelets. That is the component of the blood that keeps the blood clotted. You want to check their kidney function, so we do something called UZEs. That is urea and electrolytes, bun creatinine. So these are all tests for the kidney. So I want to make sure the kidney is good. I want to do a clotting screen. So the clotting would look at the time the blood takes to clot. So that's to check if there's any bleeding disorder.
Right.
And of course, you'll do a urine test. You'll do an ultrasound, and there are other tests like a CT scan and things like that. Now, I think we are running out of time.
So Doc, we've spoken so much about blood in the urine and some of the causes for blood in the urine. You want to talk a little bit about treatment?
Yes, but what I was thinking, because we're running out of time now, we've got about a minute only. The treatment generally will be based on what's the diagnosis. So if we're going to treat, let's say, glomerulonephritis, or we're going to treat urinary tract infection or kidney stones, there are different treatment options that we can go through. So what I would think is that when I do different topics on urinary tract infection, so blood in the urine generally is about establishing cause, and then depending on the cause, that's how you manage each condition separately.
Right.
So we will touch on that on those topics.
All right. Well, let's close off this segment for now, and we're now going to go over into the next segment. Where are we going to be dealing with questions from our viewers last week? As you know, viewers, we have this new format where we take your questions as you're sending them right now, and we are going to answer them next week, so that we have adequate time also. Even if we don't know something offhand, well, Doc always know everything, I can tell you that. But we will answer your questions the following week. And so now we're going to go into the questions from last week. And Doc, we were talking last week about blood in the stool, and so many things came up. So the first question here says, Doctor, can medications cause hemorrhoids to act up and protrude?
Well, yes. So the answer to that question is yes, right? So let me explain. Now, you have, I said to you earlier that hemorrhoids is varicosity or varicose vein, hemorrhoidal veins. So you have veins like how you have on the back of your legs. You have those veins in your anus and in your back passage. And when it is swollen, it can protrude out as hemorrhoids. And so how can medication cause it? So there are various medications that can give rise to constipation. So if you have drugs like codeine, iron tablets, which cause constipation, that would cause you to strain. And by straining, you make your hemorrhoids worse. So that is one. You have conditions like any tablet that cause diarrhea. So there are some antibiotics you take and you have diarrhea. they can cause flare-up of hemorrhoids. You have drugs, for instance, like ibuprofen, non-steroidal anti-inflammatory, which cause irritation of the bowel. That can cause flare-up of hemorrhoids. So yeah, by and large, and there are patients who use topical treatment. If you use too much of something that causes an irritation. So anything that causes irritation to the back passage, or cause you to strain more, or anything, or maybe you use the toilet more often, can put pressure on the veins and cause a flare-up of your hemorrhoids.
Right.
Again, and also, sorry, I forgot to mention, things that can cause bleeding, like if you have blood thinners, we spoke about earlier.
Yes.
If you're in blood thinners as well, you can have bleeding. So you have hemorrhoids that are already there, and there's an easier tendency for them to bleed if you're on a blood thinning drug.
Okay. The next one here, Doc. Doc, can untreated hemorrhoids become cancerous?
No. The answer to that is no. The thing is, hemorrhoids is a blood vessel, and the cushion over the blood vessel, the tissues around that, they get inflamed, and that's what hemorrhoids is. So it's not, whereas cancer, the genesis of cancer is really a cell that becomes abnormal, and it has changes in the nucleus of the cell, and it starts to multiply and go out of order. Haphazard multiplication and things. So hemorrhoids don't lead into cancer.
But can cancer, and I'm asking this question, this is not the word from the cast question here, but can cancer present itself where the condition of hemorrhoid is and that kind of thing?
Absolutely. Always, if patient comes in with blood in the stool, sometimes they come and say, Doc, I think I have hemorrhoids. And you examine them and you find it's cancer.
Right.
So you can have two things you can have. You can have cancer presenting like hemorrhoids, whereby cancer can also cause hemorrhoids to flare up. Because if you have cancer and you have something blocking the passage of stool, so cancer is a growth, right?
Right.
So in the bowel, you have a growth forming. So it blocked the passage of stool. So what tends to happen? You try to strain. And if you strain, you cause flare-up of your hemorrhoids. That is one. So you can have cancer and hemorrhoids together, but the cancer causes the hemorrhoids to flare up, right?
Right.
So that's a possibility. Secondly, we say hemorrhoids can present like a bleeding lump. So you have blood vessels, you have the tissue around it, it's bleeding, so it presents like a lump. So patients can come and they see a little lump, or they put a finger in, because hemorrhoids can be, you have different degree, first degree, second degree, third degree, where it's in, it doesn't come out, and you have one that
Excuse me.
is in, it comes out, and it goes in back, and one that comes out and doesn't go in back.
Right.
So these are different degrees of the hemorrhoids. That is different severity. So patients, you feel a lump, it's a mass, and it's bleeding, and they think it's hemorrhoids. But when you go and examine them, it's actually cancer.
Right.
So you can mistake hemorrhoids for cancer because they present with a mass and bleeding, and both can present that way. So it's a really, that's why we don't really take it. Yes, if you have got bleeding in the back passage, we always want at the back of our mind, we want to exclude cancer, and the cancer can be anywhere from, whereas hemorrhoid is at the lower end, so you can have cancer in the lower end of the rectum anus, but also colorectal cancer can be higher up where you can't see it.
Right.
So you got to put the camera and check all the way. But yes, you can have lower end anal cancer. You can have,
Mm-hmm. Yeah. Doc, last week when the show was on, and I asked the question about eggshells. The people in the comments were sending, many people said yes, they've heard of it, but some people were even saying that they were told that you should eat crab shells, and some people say you gotta eat baby crabs, right? So there are all of these local treatments, but eating crab shell seems like a very, very harsh thing to do. That crab shell.
You've never eaten crab shell? when you chew up the part of the crab and you chew up the bone and everything. That's part of it.
Yeah.
But nevertheless, coming to that. So lots of times, right, when I'm asked a question, I have to be convinced that there's medical evidence to make a recommendation.
Right.
And lots of times, so we look at what we call evidence-based medicine. And there are lots of things that are used for conditions that, one, they haven't been published, and I would not find that on an evidence-based catalog or an evidence-based database. So sometimes you may have things that are known to work medically, but it hasn't been studied or published, and I can't make a recommendation unless I have first-hand experience with it. And but I know there are lots of things, and I would imagine, as I say, if it is undigested roughage that comes out and it clips bits of it, I don't know.
Well, a lot of times, Doc, a lot of times I believe that these things come about because somebody may have had this condition, accidentally ate something, it cut out the thing, and they said like, hey, Eureka, we found the cure, So I think that's what happens a lot of time. But again, I'm just raising this because for you to give your take on it, so that people understand that, it may not work the way you think it will work.
Yes, and there are things that happen by coincidence.
That's right, exactly. Doc, on another topic, we have some amazing viewers that always, the comments out there are so wonderful. Have you heard that in Guyana, I don't know, you've been back, but you probably heard this before, that if you drink, that the guys who like to drink alcohol a lot and they go out and they drink a rum party, if they eat a fruit named Mami and drink rum, you're dead.
That is not true because.
But you heard it, right? You heard that, right?
I heard it. Yeah,
right.
I heard it.
So somebody, my thing is, go ahead.
No, there are fruits that can interact with alcohol and create toxic compound that probably can kill you. We have seen, there are plant products and fruits that can do that. But I've heard this in Guyana that you eat Mami and you shouldn't drink rum. It can kill you. I don't know, maybe, I have never checked medical ingredients to know the interaction. But when I say that may not be true, I'll give you personal experience. So my father-in-law, he does that all the time.
Oh.
And, when we go to Eskimo, he's from Eskimo, and we will go there and we'll have a drink up or something. And he would just open peel a Mami and start eating it.
Right.
And, everyone will tell him, his sisters, I would say, well, this thing is dangerous for you to drink and eat. He said, no, that's rubbish. And he ate it, and that didn't take him down.
And the reason I mentioned this is because to say that, look, maybe someone who time would have been, that the clock was up for them, and then they eat Mami and drink rum at the same time, and the clock strikes.
But, I tell you what, that may be so, but I don't want to make a pronouncement, conclusively. What I'll do on my next episode, I'll try to investigate that to see what is there in Mami if there was an interaction with alcohol.
Right.
Because there are some plant products can interact with alcohol and be toxic.
Okay.
And other drugs as well. When you have drug-to-drug interaction, it can be toxic. So I would probably have to look into that.
All right.
Maybe, I don't know if maybe the amount matters as well.
It's possibly.
Yeah, but I know firsthand people who've done it and nothing happened.
Yeah.
I wouldn't recommend it unless I have the science to back me up.
Okay, I gotta try it.
So people end up doing it, and then it's not the best advice if you're not convinced, if you're not conclusive. I'm
gonna try a drink and a Mami chaser sometime soon.
Wait until I get the science.
All right, good. Somebody said here, cyst baths are good for hemorrhoids.
That is true. So what is sitz bath? Sitz bath is warm bath, and you can add salt in it, right? So normally the temperature, the warm bath generally. So sitz bath, it is used generally as a soothing, as an anti-inflammatory, as a therapeutic bath. And what you do, you have a temperature, let's say about 37 to 40 degrees, or let's say 98 to about 104 degrees Fahrenheit. So that's your temperature of the water. And they put Epsom salt in it. And women used to use that after delivery as well. They sit in a warm bath. After any perianal condition, hemorrhoids and conditions of the perineum. So that the perineum area is, between the anus and the vagina. That's your perineal area. So what they do, they sit in the bath, in the bath, so in the warm salt bath, and it works as an anti-inflammatory, as a soothing agent, and a pain relieving agent. And it shrinks hemorrhoids. So we know it works, and we would normally recommend that. They're special. So people with a bathtub, they would normally fill the bathtub and go into it. If you don't have a bathtub, there are some buckets, specially designed buckets that you sit in or put in the toilet bowl, and you fill it up and you sit in it. So yeah, it is quite a medically advised, thing to do. Sitz baths, well recognized.
Yeah. All right. So the other one here is somebody says when you have hemorrhoids, change your diet. Also use suppository.
Yes.
Right, over the counter for hemorrhoids.
Yeah, absolutely. Changing your diet is important in terms of having enough roughage and enough fiber in your diet. We say that the cause of hemorrhoids generally would be straining, pressure onto the veins, and if you are constipated, you have a predisposition for it. So by having dietary adjustment, you know the food. If you're not having enough fruits and vegetable and fibers and water, you get constipated, train more. So changing your diet is very important. And secondly, suppositories. So what are the suppositories? Are bits you put into, like capsules, you put into the anus, right? And they dissolve. So it's like a capsule you put in there, and it dissolves. When the chemical that the capsule is made up of gets into your blood system and the area. So most hemorrhoidal suppositories are made of steroids, and we know steroid is an anti-inflammatory. So it decreases inflammation, and the suppository also have a bit of anesthetic drug in it. So like local anesthetic. So lidocaine, procaine, or one of these. You have, when you inject your tooth, you get lidocaine injection into you to do extraction. When you have a cut, doctor injects something into your cut so they can suture you up, stitch you up. So that's called local anesthetic. So the suppository is made up of a steroid and a local anesthetic, and it works as an anti-inflammatory and a pain relief.
Does it also works to soften up the stool?
There are some, so depending on what, so glycerol suppository,
yes,
where you get glycerine, it works as a stool softener, correct?
Okay.
So you have suppositories that are used for perianal condition as for the condition itself, and then you have suppositories that are used as stool softeners. So both ways you can use either one. You can use one, okay, my hemorrhoids are inflamed, we need an anti-inflammatory with a painkiller, or I need a suppository to soften my stool.
Okay.
So yeah, there are different types of suppositories, and that's what it is.
So this other question here is, what about colon cancer caused by colitis and Crohn's?
That is correct. So anyone who has got chronic inflammation. So what is colitis? Crohn's.
Both we got this cough.
Yeah, I traveled, and after coming back in the plane and stuff, I had a bit of a cold.
Yeah,
and that left me with
I've had this. Since you were here, I had this. What I don't know what virus it is, but it says left me with a little dry cough too. It's not going away.
That's it. Hopefully.
Yeah.
Yeah, it'll go soon. Coming back to Crohn's and ulcerative colitis.
Right.
So we talked about Crohn's and ulcerative colitis as inflammatory bowel conditions, where the bowel is inflamed, and you have bleeding, the lining of the bowel. You can have abscess formation. You can have perforation, where the bowel is so inflamed that it forms ulcers. Now, those patients are at higher risk for cancer of the bowel, colon cancer. And we, as part of normal treatments, of course, we will give them drug to heal the bowel. There are specific drug for colitis and Crohn's, and lots of newer drugs are in the market called biologic agents that are used. We also do surveillance. These patients get regular colonoscopy And part of that screening is to establish that they don't have any, cancerous condition forming.
Okay.
So yeah, that is a well-established condition.
All right. So we have a question here that says, what is a bladder infection? And I think we kind of covered a bit of that earlier
Yeah, in urinary tract infection, we talk about urinary tract infection. So bladder. So when part of the urinary tract, bladder is part of the urinary tract. You have the kidney, the ureter, the bladder, the urethra, right? So the bladder is one part, and that's the reservoir. That's what keeps the urine. And you have infection. When we talk UTI, that is urinary tract infection. Yeah. It could be anywhere from the kidney down to the bladder, all the way to the whole passage, right?
Right.
The whole tract can be infected. But you have bladder infection on its own, which is called cystitis. So if the bladder alone is infected and the infection hasn't, so you usually lots of infection start from outward going up, right? So you can have bug migrating from the vagina, from the urethra into the bladder. And the body has a way of confining it to that level until it is treated or the body is keeping it in check. And those are the patients, they complain of burning when they pass urine, they go often to pass urine. And then if the body can't deal with it or the infection gets overwhelming, then it spreads higher up and then it goes to the kidney. And that is called pyelonephritis. Now that is dangerous because once it reaches the kidney, you can have irreversible kidney damage or scarring of the kidney. So by all means, we are trying to avoid that. So we want to treat bladder infection at an early stage. And most times patients come, and that's a common cystitis. So cystitis is a form of UTI.
Another thing, a lot of times people don't want to go to the washroom and they're there for hours holding in this urine and it's there and it's building up and it's building up and it's building up and they don't go to the washroom often. Can that cause these type of diseases?
Yeah, so that can predispose you or increase your risk of a urinary tract infection. If you have stasis of urine, if you have an infection, your body, remember, our body has got a defense mechanism.
Right, yes.
So if you've got 5 bacteria come into your body says, watch, I can handle this 5 guys.
Yeah, get them out.
With you guys. To get them out, right?
Yeah.
But if you have 100 bacteria just swarm you, the body says, oh man, I can't manage you. And the bacteria multiplies and takes over you.
Right.
That's a simplistic way.
Yes, I agree.
So likewise, if I have an infection gets its way into the bladder, and remember, bacteria multiplies. So the bacteria keep expanding and multiplying. If I give it enough time to multiply, it will probably invade everywhere.
Mm-hmm.
But if I say, hey, no, there's a couple of bacteria here, I'm going to empty my bladder, I'm going to wash it out, I'm going to drink more water, I'll pass more urine, and I flush it out. That's the defense mechanism.
Right.
So that by itself helps to prevent urinary tract infection. So by all means, we would not encourage stagnation of urine by whatever means, be it deliberate or not deliberate. Because also when you have an obstruction, that is a non-deliberate way of your urine being kept in, as in, you have a blockage, you can't pass urine, that cause increase your risk of urinary tract infection. And all these conditions that I talked about previously about the urine, they can present, you can have urinary tract infection masking a stone, masking cancer, masking anything you can get where urinary tract infection is a false presentation. So when patients have recurrent urinary tract infection, we always want to go and check that also that there isn't something else in the background and it is just manifesting as a urinary infection.
Okay, this question here is this person. This one is off from that topic, but we take all the questions here. Is Vicks VapoRub good for cold in toddlers?
So toddler Vicks Rub is good for cold. As a cooling agent and all those properties. But the Vicks rub in toddler is what, 1 to 3 years of age?
Yeah.
Now, I know they have baby Vicks. I don't think the normal Vicks would be recommended in, let's say, a 1-year-old, because Vicks have got menthol,
Right.
and which is like a burning cooling agent, and it's got camphor. Camphor is an irritant and also toxic product. Menthol can be an irritant. So in children under 1 or under 2 maybe, I would be a little bit more cautious where these irritant agents can be too strong for the airway.
Mm-hmm.
So I would say, I think Baby Vicks, they have a Baby Vicks version, which doesn't have the camphor and the menthol in it. Yeah, I think you need to look at the product, and if it is recommended, the manufacturer will tell you. But by and large, the adult Vicks I would not use in infant or toddler.
Yeah, I can't even use that on my own self because the moment I wrote I start burning and on my I gotta wash it off. I can't deal with it.
It's just an airway irritant. It can cause if you're sensitive airway.
Yeah. Doc, those are our questions from last week. Is there anything else that you'd like to add to what we spoke about previously?
I think we have covered. I mean, I don't really, I don't want to extend our program for too long because I find that probably, it's hard to get an hour to really look at, replays.
Right.
It's hard for me to find 1 hour in a day actually to look at it. But so we want to make it interesting. At the same time, that's why I break it up in 2 half-an hours.
Yeah.
So patients can do a half and come back and do another half. So I think the format that we are doing is very good. So if you want something educational alone, you look at the first half of it. You want to troubleshoot questions, then we see the second half of it. And yeah, I think it's we can get some case scenarios as well in the second half at some point. I will introduce that.
Yeah.
But I like this format, and I think it's a good way to carry on for now, and I'm sorry I can't be in person, but I'll try to do as much as I can, I can continue the program as we are.
Indeed. So viewers, we, as Doc said, your questions are still being taken. We are going to take your questions, and for those who would have asked their questions last week, we just dealt with those questions, and for those questions coming in now, and we encourage you to send in your questions, of course, we are going to be answering those questions on our next program. Thank you so much, everyone, for joining us. It's always a pleasure being here and to have Dr. SAWH presenting these, his wide range of knowledge in the medical field and sharing these information for you, so that we it's our duty here to give you the information to make your lives better. Dr. SAWH, anything else you'd like to say as we close off?
No, thank you again and your team for making this possible, and also to the viewers for spending time looking at it.
All right, so viewers, again, thank you so much. Have a wonderful rest of the evening, and as we say on this program, stay healthy.